Hey y'all, welcome to another episode of Unnamed and Unbound, the Black Voters Matter podcast, where we speak truth to power by breaking down policies and politics in a way that is easily digestible for our folks. I'm Fenika Miller, National Field Co-Director of the Dirty South States, Georgia, Alabama, Mississippi, Louisiana, and Texas. On today's episode, y'all, we are unpacking healthcare justice and what that looks like for millions of marginalized, predominantly Black people across the country. Under the proposed Big Beautiful Bill debacle, y'all, cuts to Medicaid and SNAP benefits are worse than we thought. It's way worse than we thought, y'all. And the impact on our communities is far more harmful than we imagine. I have three incredible sisters here with me today. And before we jump in, I want us to just kind of set the stage. In 2023, y'all see this shirt, Sick and Tired, Black Voters Matter, with our partners, ACS CAN. We launched the Sick and Tired campaign to mobilize Black communities across the South to demand Medicaid expansion, to address healthcare inequities, and to hold political officials accountable, y'all, for their role in maintaining this system that keeps health disparities impacting our communities and our people in such a deep way. This campaign is rooted in the legacy of sister and ancestor Fannie Lou Hamer, and it pays homage to her famous words that I am sick and tired of being sick and tired. Sick and tired, right? Look at her right there, y'all. She's beautiful. This campaign aims to convert frustration into organized political power and structural change for our people. I got my start in organizing through healthcare. That was the arc of my organizing experience. My cousin was diagnosed with juvenile diabetes when she was a child. She was very active in the community. Both of my grandparents had health issues, rheumatoid arthritis. But my cousin, she lost her job. She had to retire early due to the complications of diabetes, and she passed away. And that was really close to 2010 when President Obama, during his administration, was fighting to expand healthcare through the ACA. And what I noticed is that Black women and Black girls didn't necessarily understand how policy affected our lives in a deep way. So started a nonprofit where we raised awareness around what we need to be doing and paying attention to close the gap, the information gap on this issue. So, that's just a little bit of background on it, that this is a truly deeply personal issue to me and to the communities that we all serve in our work and every day. I want to take a moment before we get deep into the conversation, though, to talk about Adriana Smith. Everybody has kind of heard the story of the sister who had a medical condition. She's a nurse. She went into the hospital for care, and eventually she succumbed. She's, is brain dead, and she is now being kept on life support. There are policies in our state, reproductive policies in our state that are so blurred, right, that providers don't understand what you can and can't do. Families don't understand what you can and can't do. But right now, she is on life support and pregnant, and they're keeping her that way to maintain the life of the fetus and the child. And so I want to take a moment of silence for Adriana. I want to lift up the reproductive justice advocates who are in our state, who are now fighting to keep her name on the front line, organizing around strategies of what can be done from a policy perspective to lift her name up in this story. And so I just want to take a moment of silence for her. Thank y'all. This is heavy work, y'all. It is such heavy work. But I'm so grateful to be joined here today by some amazing sisters. Y'all, this is beyond Black girl magic. This is Black girl brilliance that's sitting at the table, right? These are some geniuses. Today's guests are subject matter experts in their respective fields, but they are also our coalition partners. And so I want to take a minute for you all to introduce yourselves, and we'll start with Jennifer.
Hello, everybody. Jennifer Wells, she, her pronouns. I work for Community Change. There I lead what is the care economy team, and specifically power building in the care economy. And we look at health justice and child care, which are extremely vital issues affecting all of our lives and intersectional. So that's me. I'm based in Montgomery, Alabama. I'm originally from New Orleans, Louisiana. So I'm a daughter of the South, and I ride hard for the South.
Come on.
In all the ways.
Come on,
all the
sister.
ways. We are powerful, and we will be living in that power.
Amen. Amen. Thank you, Jennifer, for joining us today.
Thank you.
Tomica.
Yes. Tomica Smith. I work for American Cancer Society Cancer Action Network, where I lead our story work. So reaching out and talking with people who are impacted by issues like access to care, lack of access to care, and lifting those stories up so that lawmakers, so that people can understand their own power in their story and own their own story, but also that lawmakers can see them and hear them and hear what they're living with and impacted by every day. I am originally from North Florida, so I have to make an amendment, and, because I feel like North Florida is absolutely the dirty South, and raised my family in Lower Georgia, which is, the clay is red, so we have some that's considered the dirty South too, Fenika. Just a little friendly amendment there.
We'll take it.
Yeah, thank you.
I guess.
Appreciate it. Thank you. I mean, we fit. But now living in North Carolina, and our team services all of the United States. We were focused initially on Medicaid expansion in those 10 states, but now we're defending Medicaid everywhere. So we're working in all 50 states. So happy to be here. Always happy to be with BBM.
Thank you, sister. And Ife.
Thank you so much for having me. I'm Ife Finch Floyd, and I'm the Director of Economic Justice at the Georgia Budget and Policy Institute. We are a statewide nonpartisan policy research and advocacy organization. And I work on the Supplemental Nutrition Assistance Program, or SNAP. Some of y'all know it as food stamps. But I also do work on child care policy in the state, particularly how it's funded. Do some work on cash assistance as well. In fact, that's where I spent 10 years of my career working on cash assistance and making it more equitable. And I'm also a daughter of the South. Grew up in Metro Atlanta, South DeKalb. For those of you who know, you know. And recently returned back to Georgia with my family and settled in Atlanta. So happy to be here, but not happy to talk about what is at stake for our communities in regards to health and food access. But I'm ready to jump in.
All right, y'all. So we got a powerful panel. We got these sisters are just going to be amazing. And I just want to hop right into it. So we know that healthcare injustice affects our people in so many different ways. How has it impacted you? What got you started in this work? And anybody can take that.
Wow. Well, I mean, they say you do what you are. And so a lot of it for me is, growing up, I was a Medicaid kid growing up. Then was responsible for two of my brothers. And so I was a Medicaid caregiver. And then was responsible for my mother before her transition. And she was on Medicaid and Medicare. So I've lived the work that we do every day, I think that we all do and that we're impacted by. I've lived that experience. And so I'm very interested, and I think part of my calling is to make sure that people who aren't listened to or haven't been listened to, as I wasn't, as my mother was, my family wasn't, to make sure that people hear us and see us and understand that, we all say, we're all in this together, or we all, have similar experiences. Well, the truth is we all are human, right? We all are human. We all have dreams and goals, and part of that, is access to healthcare, access to food. That is necessary. And when families can't provide that for themselves, I feel like it's critical for safety net programs like the ones we're talking about to step in. They were there for me, and I want to make sure that they're there for the next generation to come. So being here is all, like I said, it's always good, and I'm excited to talk about the topics here. Yeah.
What was your entry point? Because you've been doing it for a long time.
I've been doing it for a while. I too share the story. I was a Medicaid kid as well as a SNAP kid. So these are the programs that kept me healthy and alive, and my mom healthy and alive. I would say, and I've lived the gamut, right? So I've been a Medicaid kid, I've been uninsured, and I've had what people quote unquote call good insurance. And what I've noticed is that no matter my status of insurance, there was always a question of what quality of care was I actually receiving as a Black woman, right? Or a Black girl. But I would say the thing that really drove me into this work, my mother in 1995 had a brain aneurysm. And she was on Medicaid. So she was going to the public hospital in New Orleans, Charity Hospital. She survived, miracle, faith, and a little bit of the medical profession. I would say that, because how she was treated in that process during that situation left so many questions about care, quality of care, care that's given to folks that are on public assistance, care that's given to people just as a Black woman, right? And so fighting that fight, and then experiencing my own, even in my reproductive health was put in jeopardy because people never listened to me. When I was misdiagnosed time after time, and this is when having quote unquote good insurance, or the time that I was not insured. And that was my first actual encounter with the criminal justice system. Because living in West Virginia, having an unpaid emergency room bill qualified me to be sued by the hospital and thus be served papers about how I would pay that bill. And so, yeah, it goes deep for me, this system. The work that we're doing at the Organization of Community Change is building a health justice movement that is visioned and implemented by the people who are impacted most. And I think that's what excites me the most. There are so many folks that are experiencing the disparities that I experience, but that still have faith that they themselves can help build the system that they deserve.
Absolutely.
Yeah.
Come on,
So
sister.
that's what keeps me here.
Yes.
Thank you so much for sharing that, because that's deep, and I want to take a moment to acknowledge that. So I come to this work with a belief of the inherent dignity of all people, but Black people specifically. So I used to I still do work on cash assistance, and the program that funds cash assistance today is the Temporary Assistance for Needy Families. And that changed to that program in 1996. And I remember, I was a young person, but I remember the narratives, the messages, and it was anti-woman, anti-Black woman.
Yes.
And I was like, this doesn't quite sit well with me. And that stuck with me, right? It was about how Black women are taking advantage of the system. They are not deserving of the system. Their children are deserving of the system. And therefore, we need to change it, make sure they're doing something that we want them to do, which is work. By the way, Black women have higher workforce participation rate than any other peers. We work, okay? Right. Paid or unpaid. We are working and have been for centuries in this country, right? So that led me into kind of doing that policy work in this program. But there was a shift once I started having children. And I was like, you know what? I'm not going to the hospital. I was in Maryland, and I said, you know what? I'm going to do a midwife, and I'm going to birth in a birthing center. I'm going to birth or at home. I had one in a birthing center, one at home. And I was like, this is not Black women's experience to be loved on and appreciated and listened to. And I began to realize, like, my experience was unique.
Yes.
Yeah.
And what I also began to understand when doing more of the research and the history of this cash assistance program that we have is how our reproductive choices were also integrated into the policies of our cash assistance program. So our reproductive decisions were questioned. Our how we structured our families. If we had a common law marriage, that might not have been acceptable in some states, right? To get this little itty bitty money, right? So what became very clear to me is the connection between our economic security and our health. Some people call it the social determinants of health. But it's like, do you have food? Do you have money? Do you have housing? Do you have transportation to get a job? Do you have childcare? All of those things in the policy space, they're siloed. These are people's our lives are not siloed.
Right.
This is the intersection
Absolutely.
of our lives. So that has been really kind of centered in my work, kind of really, again, after transitioning to become a mother, right? To really lift up the economic security side as integral to the reproductive justice movement and to health and well-being.
I love that. I love that. So many rich gems that you all shared for how you got into this work, right? I remember being pregnant my first time and choosing a midwife, right? And riding my bicycle to the doctor's office because I was a college student. I didn't have no car, I had no money, I had no transportation, right? But just making that choice because of what has historically happened to Black people in the medical field, right? And then social determinants of health. I call those political determinants of health, right? Because there is somebody pulling the lever of power and making a policy that keeps us on the margins and on the fringes to be able to make those decisions. And so helping Black women and girls especially, and just our communities in general, understand how these things impact our everyday quality of lives. Which brings me to, what happened up there in D.C., a week and a half or so ago, that, by just one margin vote, y'all, House Republicans passed legislation that would cut trillions of dollars in taxes for billionaires while cutting Medicaid, SNAP for millions of Americans. Currently we have 10 states that have not expanded Medicaid. And Tomica mentioned Georgia, Florida, South Carolina, Tennessee, Alabama, Mississippi, Texas, Kansas, Wisconsin, and Wyoming. Yeah. 1.4 million people are uninsured in this country. Can we talk about the impact of those policy determinants of health and food and well-being on our communities?
Ooh. That's a big one. That's a big one. First, the debacle and the nastiness, which has always been their intent, that there be no question about it. They've always wanted to cut whom they think is undeserving and dispensable. And that's always the poor.
Yes.
And it's Black community.
Us.
And it's Black women.
Yes.
Somehow we are always on that list.
Yeah.
So there's that. There's another thing, a part of that vote that the conversation is a little bit unsettling for me, and that's you mentioned it was a 1 vote margin, and we know that we've had some elders in the Democratic Party that have passed away, and what frightens me about even the conversation is before people are talking about the danger, the horror, the vileness that's laced in that policy, the things that will be cut, the people who will go untreated, unfed, who will die, is that people are first turning and saying, well, if that guy didn't die,
come on,
maybe we would have passed. No. Understand the intent this plot has been building for years, for decades. There was not one vote that got us there. It was the fact that there were 3, I think maybe 2 that didn't vote. They voted present. So I'm talking about Republicans. And one that might not have voted at all. Had that particular Democrat lived, they would have played their role. They're all playing a part.
That's right.
So I think that's the first thing that I want our people to acknowledge. This is intentional. These are roles that they are playing to get to an end, and the end is always on our back. So never lose that thread. So that's one thing that's coming up for me. And another thing that's coming up for me is just around what these cuts will mean and who actually will benefit. And the benefit is always going to be in some already wealthy, well-heeled person or corporation's pocket. There's a plot that will make certain that the money that was geared towards our survival, our thriving, our ability just to get to the day-to-day is actually going to impact some corporation that's going to be doing the dirty work of making certain that and I speak specifically about Medicaid, and I'm thinking about the ways in which they will make the cuts that will then trickle down to the states and local areas or local municipalities will have to make horrific decisions about who will get money, what program will, what program won't, and they will make those decisions. Somebody will be harmed. And all the while, the person that's policing that decision, the millions of dollars are going to go into their pockets instead into the programs, right? So there's that piece. And then there's the idea, and I'm losing my thread.
It's all right, sister.
There is, oh God, I forgot where I was going. I'm going to stop there. I'll come back. I'll jump in.
You drop gems.
You did.
What y'all got? I heard you over here.
No, absolutely. Well, I mean, I think, there's a huge concern with the cuts, and not just with Medicaid, but also the marketplace cuts, because they're going to impact the marketplace plans. People who have Medicaid, make no mistake, 8.3 million people will lose coverage, and people will die. Cancer patients, diabetes, children, elder. People will die because of these cuts. And then with the marketplace plans, what they will do is they will become more expensive and harder to reach. So what was a gap that we call Medicaid gap, right? So you had people who had Medicaid, and it's hard as heck to qualify for Medicaid in most states. And then you have people who can afford private insurance. You had this gap, and then all of a sudden this sort of bomb of the big bill was dropped into the gap, and now it's a crater. So now we have millions of people who Medicaid's going to be harder to get. Marketplace plans are going to be hard to get. And so people will be struggling to be able to afford nursing home care, child care, cancer screenings, diabetes, insulin, high blood pressure medication, anything that you could think of that you would use your healthcare. And that's the other thing too, with, one of the things that we know for sure is that access to health insurance coverage is one of the greatest predictors of whether or not someone will survive cancer. Having access gets you in the door so that you can get the screening, you can get the treatment, you can get the prescriptions that you need. Without a card, they're not letting you back to the bag.
That's right.
You have to present some form of treatment and some form of payment in order to get that treatment and to get it quickly, right? Because that's the other piece. African Americans, cancer, they hold this cancer burden. They carry it. We carry it on our backs. So with African Americans this year, we know there'll be about 248,000 new cancer diagnoses among African Americans, 70,000 deaths among African Americans. Cancer is the second leading cause of death for African Americans in the United States. We're talking breast, lung, prostate, colorectal cancer. Those are the leading. Black women, we talk about black and all the work that we
disparities.
do. Black women are like 38% more likely to die from cancer than white women. 38%.
Pause right there.
38%. We're smaller in population, but 38% more likely. Black men are twice as likely to die from prostate cancer than white men. So having access gets you in the door, it gets you treatment, and this is exactly what they're taking on. They're pulling the rug up from underneath vulnerable communities, like the communities that we serve. So, you called it a debacle, and I 100% will agree with you that it is not a big, beautiful bill, and in no sense of the word, for marginalized populations and African American communities. So we are constantly, talking to legislators, talking to people who will be impacted, who are impacted right now, who are on Medicaid and are telling you, I will not survive.
Absolutely.
The medication that I have for my cancer, I get a 30-day supply, and that's it. If at day 31, I'm in trouble.
You're off. That's right.
And so that's what's at risk when you say you're going to cut Medicaid for cancer patients. At day 31, they're worried. One woman we talked to, $14,000 a month for her treatment. She can't afford that. And she talks to us about how the fact that, she had the treatment that she had the cancer, but now she's able to see her grandchildren.
That's right.
She's able to help her children take care of her grandchildren, and talks about the role that she plays and the important role she plays, of course, in her family's life. But she needs access to healthcare to be able to continue. We talk to people who have the tax credits, and that's the other piece. These tax credits were expanded just after the pandemic, and so you had a great number, probably the largest number of Black people enrolled in marketplace coverage, Obamacare, ever after those enhanced tax credits came through. They're set to expire in 2025. And don't look like right now they're going to be renewed unless we keep pushing, unless there are changes. And so with people who have tax credits, they pay for their health insurance, but they will tell you, I can't afford to pay anymore.
Absolutely.
I can't afford for this, $100 to go up to $200 because then I have to choose between whether or not I'm going to eat or I'm going to pay for my medications, right? You hear that all the time. We used to hear about it with seniors.
Yeah.
Seniors making those decisions. Now we're talking families
Yeah.
who are making those decisions. And then if you cut SNAP on top of it,
That's it.
What will people do? They will die. And I think that is part of the design is for there not to be any assistance.
Absolutely.
So that people have nowhere to go. And that's unfortunately where we are, and that's why we have to keep doing things like this. We have to keep talking, we have to keep telling stories and sharing stories and taking them to the people who are making the decision so they cannot make that decision and make that vote and say they didn't know.
That's right.
Because we told them.
That's right.
We told them.
That's right. And sometimes they know when they don't care anyway.
Exactly.
But you talked about making a decision between your health and your food.
Yes.
Right? 13% of all Americans are food insecure. And so I want to make sure that I bring you into the conversation to talk about those choices.
Absolutely.
My health or my food.
Absolutely. So I feel like a lot of the public conversation around this bill is centered on Medicaid. And we heard why that is so important.
Right.
We need to continue to bring SNAP into the conversation because of the linkages.
Yes.
I mean, it's just like you need food and you need healthcare. I mean, these are basic needs. These are basic assistance programs. So what we have seen in this bill, a fundamental change in the structure of the SNAP program is that's what's being proposed. So right now, 100% of SNAP benefits are funded by the federal government. So all those benefits are flowing into every state, every local economy, and supporting, if not enhancing, those economies, right, with those food benefits. What is being proposed is that starting in 2028, states will have to cover some share of those benefits, ranging from 5% to potentially 25%. That's tens, if not hundreds of millions of dollars that states would have to shoulder if they're trying to maintain the level of benefits, right? That's not likely, right? That's an expense they never covered. Never exactly. Right. So they could do a few things. They could raise revenue. Right. They could meaning taxes, right? We're in the South.
That's right.
That's a big lift.
Talk about it.
Okay. Georgia right now and some of our neighbors are talking about lowering income taxes, if not eliminating the income tax. Florida doesn't have an income tax, I believe. State tax. Yeah. So
North Carolina does.
North Carolina. Okay. But we are already kind of struggling to make sure that we can just pay for the essentials that we have right now. There's other ways to raise revenue, but let's just say that could be a challenge in a lot of southern states, but other states as well, Midwest as well, right? You can cut other programs to pay for SNAP if you want. But that means what's going to happen to those other critical services. In Georgia's unusual. We have a multi-billion-dollar surplus, but our state leaders and appropriators and our governor has set a precedent to say, well, we are not going to use one-time funds to pay for ongoing expenses like a new cost shift, for example, right? So what's left? What are if a state isn't going to take those choices, you got to cut the program.
Absolutely.
Right? And let's go with this 5% share. I just want to kind of illustrate what that looks like. So in Georgia, 5%, this is current levels of spending. That's equals to about $162 million a year.
Just 5%.
That's 5%. It could go up to 25% based on this sliding scale that they have. But that's a lot of money.
Yeah.
But that 162, it doesn't have to be 162. It could be 80 million and say like, well, that's our 5%. So if it's a share, if it's a proportion, that means the federal amount goes down too. So the whole pie shrinks. And if a state says we can't cover any of these costs, they can opt out,
like they did with
the
Medicaid
food stamp program. So talked about choices between food and medicine. These are the choices that people are making now, and it's easier for them to make the right choice because they have SNAP benefits and they can pay for that food and afford that medicine. So that's one of the biggest issues. And then the other piece I want to name too, because, and this is true for Medicaid, is they are expanding, I'm calling them work reporting requirements, because they're not really work requirements.
Right.
Let me be clear about the reality of these requirements, because people might hear that and say, well, yeah, people should be working. I'm not going to get into that debate. I'm going to talk about the reality of what these requirements are.
Right.
And the reality is that they are burdensome, just red tape, not only for the individual who has to try to meet them, but also for the state to try to make sure people are meeting them. So if you have some kind of exemption or something, you have to submit paperwork for that. If you live in a rural area, a lot of paperwork is done online, but you don't have access to the internet, all of that. Offices aren't really open like they should be, all the things. And the research shows time and time again that these requirements do not increase wages. They do not lead to economically secure jobs. They do a better job of kicking people off the programs than actually helping them afford their basic needs. And if you look even deeper, Black people are more likely to be cut off because of all of our this systemic racism embedded in our labor market. Discrimination, occupational segregation, all of those things limit our ability to work and find good jobs, right? So we are more likely to lose assistance because the low wage labor market for us and for a lot of people does not work. And that is the other piece. If you are working hard, right? You could be working a few hours one week and meeting the requirements,
but not the next.
Next week your hours are cut
with no control.
No control. People know, y'all worked in retail before. You know, like that's the reality. Or for low income people, their lives are just very complicated. So your kid gets sick. You can't go to work. You need to take care of your kid. You might have lost your job. And what are you supposed to do? So these work requirements are now in SNAP would now say you have to work until you're 64. You could have worked for 40 years. You're tired. But you got to keep working if you need a little bitty SNAP benefits. If you are
little bitty,
tiny,
it's little bitty benefits.
I don't want to undermine it. It's good, but it
meets the need.
SNAP benefits are still a lot lower than food costs in most counties in this country. And they're also saying parents with school-age children, 7 to 17, you'll have to work. There's a carve-out for people who are married. So they're saying single parents
get nothing.
You got to meet these requirements. But if you're living in a household and let's just be stereotypical for a second, but the husband's working and meeting the requirements and the mother is taking care of the kids, she homeschools kids, whatever, she's okay. She doesn't have to meet the requirements. The household preserves their full benefits. Let's take a similarly looking household. A sister moves in with her brother to share housing costs, right? She has kids. She works while she can, but she ultimately takes care of her kids, right? Before or after school. He's working full time. Under this provision, she would lose benefits, and the whole amount of your SNAP benefits coming to that household begins to decline. So what we heard when this bill was being considered is like, it's not going to impact kids. It's not going to impact kids. It's not going to impact kids. It will impact children. And if states have to cut back on the program and reduce who can access it, or reduce the kind of the barriers to access, or increase the barriers to access, children will lose.
Absolutely.
So I'll pause there.
Because you unpacked a lot of stuff in that, right? You unpacked the tropes that
Exactly.
Black women have had to endure. Welfare queens back in the 1980s.
Right.
It's still
You
And still.
unpacked, and still, absolutely, unpacked, the choice between health and food. We talked about that. We talked about, I mean, it's very rich, right? It all boils down to racism, right? It boils down to this administration being one of the most anti-Black administrations that we have endured, right? That we know that during the first cycle, his first administration, they didn't have all the pieces together. But now they have all the little pieces together and they're doing exactly what they said that they would do, y'all. Racism is still, the crux of it. And it is a public health crisis. And I think all the things that we've experienced in the last couple of years in 2020, since Black people set foot on this land, right? That we've understood what racism is and how it impacts our communities. So yeah, y'all, this conversation has been so rich. We've talked about so many things, the interconnectedness between health and food, our origin stories. You talked about cancer and disparities, just the health disparities that are impacting our community. You mentioned 38%.
Right. Black women are 38% more likely to die from breast cancer than white women.
Yes.
And Black men twice as likely to die from prostate cancer than white men.
Yeah. And so, we think about cancer as one leg. We don't even think about, chronic diseases like heart disease, stroke, diabetes, blood pressure, asthma, maternal health, mental health, y'all, obesity and food insecurity in Black and rural communities, all the environmental factors that impact our health. We talk about asthma. You talk about the air that you breathe in rural Black communities. You talk about communities that don't have clean water for drinking. You think about what that does to your skin when you're taking a shower in water. Access to doctors and hospitals in rural communities. Fresh fruits, grocery stores, what does that do? So, as we think about, all of those disparities, what are some of the most common stories that you all hear in your day-to-day work around all of these issues?
So, first I think about some more of the statistics around food security. So you mentioned already that about 13% of Americans are food insecure. For African Americans, it's 23%. And for American Indians, for example, it's around that, if not higher, 24, 25%. But for white Americans, it's 10%. It's less. So we know that there are racial disparities when it comes to food security, and because of that, about a quarter of SNAP recipients are Black, and that's we're about 13% of the population or so, give or take a little bit. So it's because of the need, right? And I just want to talk about this kind of piece of having access to nutrition as it relates to health, because again, I think you also said obesity rates and whatnot. If you look at Black communities and the food deserts that they are, or the food choices, it's a lot of convenience stores, dollar stores, gas stations, and they accept SNAP benefits now.
Yes.
They'll accept some SNAP benefits. But even if you don't have SNAP, that is what is close to you. So just our built environment, if you're hungry, you're going down to get, a little snack from the convenience store, right?
Yep.
Going to the grocery store, if you have transportation, that could be significant, particularly in rural areas.
Because everybody doesn't have a grocery store.
Everyone does. So actually, let's talk about that. So in Clay County, Randolph County as well, this is Southwest Georgia, part of the Black Belt, has a lot of inequality and poverty. They have about nearly a third of their population receives SNAP benefits. But the SNAP retailers, so those are the convenience stores, grocery stores, and the like that take SNAP benefits, I think in Randolph County it's about 18.
Wow.
Clay County is less than 10.
Wow.
So, what are they supposed to do? They're going to they're going to, and those are all the retailers. So I'm not sure what the grocery store numbers are, but I'm sure they are few and far between. So that is what we're talking about when we're talking about systemic racism.
Come on.
You know, and how that interacts with our health. If you only have access to these food sources that are not high quality, nutrient dense food, you're going to create health conditions or exacerbate health conditions.
Absolutely.
And if you have SNAP or don't have SNAP, and you do have access to a grocery store, you have diabetes. You can choose the low sugar jelly, or you can choose the regular jelly.
That's right.
And you know, whether you have the resources or not, you might go with the cheaper, high
That's right.
sugar, high fructose corn syrup jelly. And we think that that doesn't matter, but if you're under a doctor's, if you have a doctor who's saying you need to lower your blood sugar, like that matters.
Absolutely.
And this is what we are talking about as it relates to our food access and our health access.
Yes.
Right? It is around our built environment and the fact that SNAP benefits actually support our food distribution system.
Yes.
So I told you those counties don't have a lot of SNAP retailers to begin with. In a third of those counties, the people in those counties receive SNAP benefits. If for some reason those SNAP benefits are cut or reduced, you're affecting the bottom line of those SNAP retailers.
That's right.
And in some states, I don't know if this has happened in Georgia, I'm not going to say it hasn't, grocery stores have closed because of that.
Yes.
So you're talking about not only losing hospitals, you're losing grocery stores.
Yep.
Yes.
I want to bring Jennifer into the conversation too.
Yes.
Because I heard you over here amening.
Yes.
And I want to hear from Tomica around some of the stories that you're hearing in relation to.
Well, I'm resonating so deeply here, and I'm resonating on who, again, it goes back to the deserving and the undeserving, right? So deserving communities, undeserving communities.
Yes.
The idea that we always want to put the blame on the individual, this is where the work requirements are coming from. It's your personal responsibility to do more to earn this, never talking about the systems in place that they keep you down, right? They keep you oppressed.
Yep.
And they never allow you in certain ways to break out. And I'm thinking about even how we use the terms food desert and maternal health deserts when actually they're apartheid, because this is a whole system, right? These are decisions, these are policy choices that they're making for someone else's pocket to be lined. But when the time comes to answer for it, it's your fault you didn't eat better. It was your fault that you didn't earn enough money to buy that fresh vegetable, right? Not the fact that it was never available or that it was intentionally kept out of your community. Thinking about the Medicaid system and the ecosystem as we're fighting to make certain that people have care, which I also want to take a step back and think about the fact that the healthcare system itself is only for the sick, right?
That's right.
It doesn't talk about preventative care,
That's
right? We're not talking about how do we stay healthy, and healthy is the goal. It's always who's making, and I'm sorry I'm on this thread, but who's making the money because you're sick. So keeping you filled with sugar when they know that the option for you probably is to have a chronic disease, now allows you to have to spend money to be treated, right? And that's what they put you on, just treatment, not cure. That's right. Just treatment. And so it brings to mind the fact that the cuts that are coming down from the Medicaid system, I use this line a lot, and I think it resonates deeply with me. If you are poor in this country, you're going to be sicker. And if by any chance you get sick, which we all do, you're going to be poor. Your pockets will be depleted. And that goes to any economic status, right? If you're poor, you're going to get poorer. If you're middle class, you're going to be struggling, which I found in not only in my family, but in my local communities' lives. And that the money that is not coming down from the federal government, what this horrific bill is going to do, cutting the money for food, cutting the money for health care, it will put the burden on states, put the burden on local municipalities, who again are going to have to make some dangerous decisions about who gets what funding and who doesn't. It's going to close hospitals. My own personal story is I had a really good primary care doctor in Montgomery, Alabama, whose hospital system is now going bankrupt. Before this bill has been put in place, before it passed the House, it's only going to get worse if it moves on further and gets past the Senate. They told my primary care doctor, you're going to have to take a 40% pay cut in order to remain in Montgomery and serve the community you serve.
And what does
I
that
wouldn't
mean?
take a pay cut.
That's
Right.
So that
What does
person
that mean?
left.
Yeah.
And I lost my primary care doctor, but not just me. A whole host of people lost a primary care doctor. That is we all pay the price. I'm sitting here fighting to the death that Medicaid remains.
Yeah.
We need to improve it. We need to expand it. It needs to be much better.
That's right.
But we can't lose what we have.
We got to defend it.
We have to defend it because it will only get worse for all of us. All of our premiums are going to go up.
Yes.
Right.
All of our healthcare costs are going to go up, along with the fact that I know my people in the Black community are going to go untreated and they're going to die.
Yes.
Particularly Black women who are struggling to put food on the table,
Yes.
who are taking care of generations of their family. Right? They're going to pay the cost. And also the environmental aspects of health, the stress. That's the racism, right?
That
This
is
is
the racism.
generational.
Yes.
The stress, my mom's brain aneurysm, her high blood pressure was not salt-based. It was stress-based.
Wow.
Working or not working. And by the way, I believe unpaid labor, whatever I'm doing in my home and in my
That's
neighborhood,
labor, baby.
is just as worthy
That's
as
right.
anything that I punch a clock for. But all of that takes a toll on our bodies, and our bodies are already carrying generations of pain.
Yes.
Generations of stress
Yes.
that are only being exacerbated by everything that we experience in the environment, everything that we experience on the job,
Absolutely.
everything that we experience by policy choices that people are making. And so that's what's just sitting in my heart right now as we're talking about this, and the fact that we can do better. I want people to understand this doesn't have to be.
Yeah. And we
We
have
are-
the power.
we have
to
the
do
power.
better.
We have the power.
We got the power.
We have the power.
You know, the first time I walked into a hospital and I saw no Medicaid accepted or a doctor's office.
That's right.
I was completely shocked. You know, and so if that's the only care that I have, and you're telling me that it's not accepted
You're not welcome here.
That's right. What am I doing here? And so, you know, Jennifer, you talked about your mom. You know, that's such a powerful story, and the stress that we carry. You know, Black people we've bared the brunt of this democracy on our shoulders since its inception, honey. And it's always racism, obstacle, barriers that are put in our path to keep us out of progress. I call them the opponents of progress, right? So that's what this bill is. These are the opponents of progress, folks who are trying to roll back all the gains that we have made, right? I want to talk about this in due season and some of the stories that you all were able to collect from folks in communities. I want to hear, what are you hearing on the ground, and why was it so important to tell those stories about Medicaid expansion and why folks need this care?
It was really important to tell the story through In Due Season, the film, because the story hadn't been told before, right? We have not really talked about and seen how racism and racist systems have been integrated into healthcare systems and healthcare policies, like we do now with these 10 states that haven't expanded Medicaid. They are absolutely refusing to expand Medicaid, and so it was really important to show the impact of that. And I think one of the good things to point out is, you know, a couple of people in the film, Brian, I think about Nidra and Miss Pam. When we first started talking with them to be in the film, none of them had healthcare. Since that time, it's been about 1.5 years. They've gone in and out of healthcare.
Wow.
Sometimes the marketplace plans, then no care at all, then back into a marketplace plans because of the fluctuations in the market, in their communities and where they can work, and then paperwork systems with the Medicaid program.
It bogs you down.
It does. It absolutely does. And so it's important to tell that story and to show that these are real people who are being impacted. Not just people, but families. Nidra talks about the fact that, you know, her family has been on the land where she is in Mississippi for generations, for as long as she can remember. She wants to stay in the house where her parents raised her and raised their families. And in order to do that, she works 3 or 4 entrepreneurship jobs in her community, so that she can make ends meet, so she can also be a parent to her children. Right. She is a single mother, a proud single mother of 3 very beautiful young men, and she wants to be hands-on with them. And so to give her that opportunity, that's what she has decided she has to do. I've got to work for myself because I can't find a job that will allow me the flexibility to be the mom that I want to be. And I completely applaud her for that. But what that means is there isn't a lot of income.
That's right.
And when there isn't a lot of income, it means that you cannot have a stable health insurance coverage plan, and so she has been inside and outside of the marketplace, in the year and a half that we've talked. Brian also, and he's in Florida, but same thing. When we talked with him initially, he did not have health insurance coverage. Now he has a marketplace plan. He sent me a picture. He went to his diabetes, and he talks about his experience with diabetes. And when he is in the coverage gap and doesn't have access to healthcare, he controls it with his diet. So in the film, we see him making himself a meal. So that he can, control his diabetes. But as soon as he was able to get health insurance coverage through the marketplace, he sent me a copy of his paperwork from the doctor, and he said, "I'm so thankful to have health insurance. I know now what I need to do for my diabetes." He was buying the over-the-counter medicine that you can get, the insulin that you can get. He said, that wasn't working for my body, and I didn't even know it. He didn't know it until he could get access to care, to get that card, to see an actual doctor who would run the test on his body and tell him what worked. But it took him having access to care to do that. So we hear those stories. Cliff bravely tells his story in the film as well. We hear from Dr. Karen Winkfield, who points out just the history of racism in America, and particularly in these southern states that just refuse to expand. And we keep hearing the stories. Now that we're protecting Medicaid in all 50 states, right, in Puerto Rico and Guam, we're hearing from people that will say, absolutely, I wouldn't be alive if it were not for Medicaid. That's right. I wouldn't be alive if it was not for my Obamacare plan or my marketplace plan. It is what gets me the medication that I need just to stay alive. So telling the stories is critically important, that we continue to tell the stories, to lift them up so that everyone is aware of who is being impacted. Because we all know somebody we've all been impacted by cancer. And we've all been impacted or know somebody who doesn't have access to health insurance and is struggling in some way. So it's important to get those voices out there so people don't feel like they're alone. That's right. There's no shame. And that's a real big thing in the South. It's like pull yourself up by your bootstraps.
What if you don't have boots?
Yes,
you don't have boots. How do you have no bootstraps?
You have no boots, you have no straps. And then, what goes on in my house stays in my house. I know my grandma said that. My mom said that. For our community. It is huge, and I understand that, and I respect it, and I know where it comes from. I think we're at a point now where we have to be able to, in safe spaces and with safe people, tell those stories so that they can hold those stories and lift them up. And if you want us to share your story and you take out your neck, we can do that. But it's important for that information and that story and your experience to be out there, because your experience is valid. Absolutely. And you should not be shamed for needing help or wanting help. That's what the safety net is about. That's right. That's what it's there for. That's right. So strengthening that safety net is what we are here to continue to do, so that people aren't falling through. It's not a gap now, it's a crater. That's right. And we want to make sure that we keep that closed as as possible, and so we're going to keep doing that work.
That's right. I mean, you said so many things, the way that we share our stories is through our history. For those of us who are Bible readers, there's a scripture that says we overcome by the word and the testimony.
There we go.
And the testimony. Because your testimony, your lived experience is going to help somebody else overcome. Yes. Right? And so the power of sharing those stories is that somebody in rural Georgia or the middle of Mississippi or Utah or wherever can say, hey, this thing happened to me, right? I'm experiencing this same thing. And then we call other people into this work and into this process. Right. And I think that is the power of the work that we are all doing. How do we get more people to get into this work? We know that it is racism. We know that it's about a lack of care, about coverage, around access. We know that folks have a policy agenda. But how do we get more soldiers into this work? How do we connect the dots between everyday policy decisions and our everyday quality of life?
Yeah, that's right.
What does that look like? What does resistance look like, y'all?
Well, I think first it means rest.
Y'all see how we set up? We ready to fight? Well, come on now, talk about it.
I think it means rest, especially for Black women, especially right now in this time. And I think you should not be ashamed. You should not be afraid to rest. And to call it rest and to say, I'm doing nothing today. I'm going to sit around and just do not Netflix and chill. I'm just going to do nothing today because it's what I need to do for my body to rest. Because you have to have rest in order to go out and continue to fight. And we have not rested. Yeah. We have not rested. And rest has not been, it's been a luxury almost. That's right. It was from my grandmother. It was from my mom. But
It is for you.
It is for me, but I'm refusing.
Come on, sister.
I'm refusing. I am resting, and I'm resting comfortably, so that I can fight, so that I can take in all of this knowledge and connect with people who understand what's going on, and then really, the storytelling is what's important for me, because I want people to be empowered, and I've seen people be empowered by hearing. You tell me your story, I'm gonna write it down and I'm gonna give it back to you. I have people weeping on the phone because they have not been seen.
Yeah.
People get tired of hearing me complain. No, I want to hear what you have been through, so that we can lift that up and we can let other people know, because somebody else is going through it.
Right.
So that testimony, like you said, is critical and important. But I think before we do that, we have to rest.
Yes.
We have to rest.
Yeah.
I feel that. I feel that, and I'm going to take that advice.
Yes.
What I see is resistance, and I think, and I brought this story up. I often bring this story up, and it's my maternal line is very strong. I come from a line of fierce women, and my grandmother, in hard times politically, in difficult, oppressive circumstances like we're in right now, I think about the fact that this is a woman who was raised in rural Louisiana, who did not even speak English as her first language. She spoke French Creole. Who did not learn how to read or write, which was why education was so incredibly important for the generations that followed her in my family, but who was able to live, own a business, raise a family, and work the system in order to buy a home in New Orleans in what was Jim Crow, Woodrow Wilson South, right? And I call her in, her energy, her spirit in, as I think about what is needed. And I also think about how she organized locally, right? It starts with your neighbor. In this age where we are disconnected and we're so quick to jump on Zoom or on social media or online, it actually is taking the time to go and build a relationship with your neighbor. Have a conversation, understand each other's story, tell, because we share so much, and build from there, because we are sharing the same circumstances, and understanding that when we fight together, we win. Absolutely. And if it's starting at the local level and positions in your local community that you think don't matter. I'm remembering living outside of the South. I've lived in West Virginia, which is a whole nother aspect. It's a different South in the Appalachian region, but understanding the importance of it was where I first learned how important county commissioners were.
Yes, come on.
How they run budgets.
Come on.
When your city needs money, when your unincorporated or your town needs money, they typically hit up the county commission. And whenever I asked a group of people in my neighborhood, who's our county commissioner? They could not name one.
They didn't know.
So here are these people that are making choices about your lives on a daily basis, and we don't even know who they are. Right. It starts there. So to me, the resistance has to start local. We have to be strategic. I love policy, and I also am fully aware there has to be a complement to that, and that is action.
Yes.
And so persuading someone to do the right thing only can take us so far.
Yeah.
We have to take what power we have in our hands, wrestle it away from them, and use it.
That's right.
Right? And it will be in elections. It will be the fact that they understand we know who they are. They are not able to live undercover. And that we are able to take them down.
Come on.
Right? And we're able to run in those spaces. And we have organized not only candidates, but candidates who know how to govern. Right. And they know how to govern because they're connected to us.
And use their power for good. Because don't just know how to govern.
Yes.
Don't just talk about it when you're at my door.
Yes.
But how are you going to use your power for good?
Absolutely.
How is that budget going to speak for you?
Exactly.
Come on now.
I want people who stand in courage and in action. And I'm thinking about, and forgive me for not remembering my elder who stood up when Trump gave his State of the Union speech, but was the only one.
Congressman
Al Green.
Yeah.
Al Green. I was so excited when I saw that action because we need it, and we're going to need a whole lot more of it, right? When you see wrong, you say it.
Yeah.
You speak it, you scream it. But if you see someone else, you don't let them stand by themselves. You walk out with them. They could not have stopped if all of them had stood up.
Every last one. I mean, that's another story.
That's another story.
Come on now.
But
that's another podcast. That's another podcast. What about you?
You know what? I was talking to you about this. I'm feeling very depressed and very low right now because this is a hard time. So it's actually kind of hard for me to think about resistance, but I'm going to lean into what you said about rest And I think the other piece I would have to say, I mean, my colleagues have said it beautifully. I don't know if I have any more to say, but it is, I think, this one-on-one community-to-community education that's really important.
Yes.
Talking to your, you're listening to this going to the camera. You're listening and watching this podcast, right? You're learning about what's happening at the federal government, all the craziness that's happening. Take this information, go to your grandma, go to your cousin, go to your best friend, your neighbor, and talk to them about, did you know that they were gonna do this, that, and another?
That's right.
To give money to rich people who already have it. I mean, that's literally what's happening. They are stealing from the poor to give to the rich.
Right.
So I really do think that could be powerful if we are doing that in every community.
Absolutely.
And I will say also, Black folks live everywhere, not just in districts that are represented by Democrats.
Come on now.
Right.
That's
they
right.
live in districts that are represented by Republicans, and they need to hear what is going on in their communities.
That's right.
I definitely think the local leaders are a lever to actually connect. Because those local economies, because we have to bring in the economy, sometimes like the human impact is not enough, unfortunately. Yes. But if these grocery stores are closing, if hospitals, in fact, it's because the hospitals have kind of said like, hey,
bye.
Don't cut Medicaid, we're gonna go.
Right.
Now we need grocery stores
That's
to
right.
step up. Now
That's
we need farmers to say like, actually, I benefit from SNAP benefits.
That's
you know?
right.
So if we can continue to get those types of voices as well as individual voices, I think that is important. And again, like I said, across Georgia, Black folk live in different places.
Yes, that's right. Yes, that's right.
Across the United States,
Yes. Right.
We live in different places.
We're everywhere,
We need
y'all.
to make sure it doesn't matter if you have a Democrat, an independent, or a Republican representing you. You need to engage with them, or at least engage with your local leaders and tell them to engage.
That's right.
That's what I would say.
Thank you for that.
Just speaking to that for just a second. We live everywhere.
Yes.
Living in West Virginia was one of the hardest, not for the people in my community, but just for the political environment.
Sure.
But the anti-Blackness that is laced in this bill,
Yes.
the level of what they wanted to rain down on Black community, because they thought that we were going to be the biggest impacted, and we are, because the disparities are so. And I love how you're saying the disparities are only going to crater even more. But understanding what you came for us is going to impact
Everybody.
Exactly.
Come on.
Because the grocery store is going to close down.
Yes.
And those are jobs
That's right.
that
Yes.
will not be in the community.
Yes.
The hospitals will close down. I mean, so the gas stations where they're taking SNAP
That's
benefit,
right.
it's going to be an economic collapse.
Yes.
of all of
community, every
magnitude.
community, particularly rural communities.
Exactly.
And so I'm not.
The comfort in which the comfort they had in voting some of these folks that are in the current administration, the bills as they were coming down, the document that was long preceding, letting us know
That's
exactly
right.
what they were going to
That's
do.
right.
That one.
And the comfort
Project
that
2025.
prior to
That's right.
2025, they were comfortable because they assumed it would not touch them.
That's right.
And they being non-Black
That's
folks.
right.
It's just not.
And now they have to understand that when this bill, with the magnitude of impact that it has, all of our lives.
Everybody's life.
All of our lives.
That's
You
right.
may be doing well right now. Trust me, you won't be doing well once
Yep.
this stuff is implemented.
Right.
Absolutely.
And then understanding unlikely allies, sometimes we're going to have to see some line of solidarity. I'm always going to ride for the South. I'm always going to ride for Black. But I also am aware there are other people that are going to be that in this fight that I'm going to have to connect to.
That's right.
So we should not exclude, but be very strategic about how we
We got to
move.
be strategic and intentional.
That part.
Because we said we've bared the brunt
Right.
Yes.
of propping up this democracy, right? We've talked about the importance of rest.
Right.
Of letting your central nervous system be at rest,
Right.
right? You talked about the stressors that impacted your mom, that it was not a health, it was stress, right? And so I'm just so proud to be at this table and in this room with all of y'all. Like, Black Voters Matter, like, we have an amazing network of partners, right? We have an amazing network of partners who are in communities across the South and in, you know, all these states that we are in, but we are not the experts. And being connected and in coalition with y'all who can give us the language to then go back to our communities to help them organize for themselves, you know, to advocate for themselves, to bring more people into the process, to lift up that there are thousands of local elections that are happening this year, y'all, in 2025. Thousands of local elections that are happening, mayors, city councilmen, commissioners, water board, authority members, EMCs, all the things that we talked about that intersect and that are connected to our health, to our food, to our livelihood, right? And so just being in community with y'all and just being able to share this space has been amazing. It's so much gratitude for the work that you all do, for what you bring. I told y'all it's going to be beyond Black Girl Magic. This is Black Girl Genius, y'all. We will be sharing out some resources from each one of the organizations that you all, that our listeners can take to. And for those of y'all who are listening right now, I don't know, you know, I feel energized, right? I hear what you said, that you're still there. But we are, everybody has a role to play. You tag me in.
Exactly.
Tag me in, sister. And then I'm going to tag you in when it's time for me to rest, right? Right now, I'm fired up, and I know that our partners are fired up. For those of us who are fired up but who don't know just where to start, what's the first step? You know, what first step can you take to support Medicaid expansion in your state? Y'all stay connected to Black Voters Matter. Follow us on social. Visit our website to volunteer. Get involved. You know, join a local partner, groups that are organizing in your community. Invite these sisters to come down to your community to speak, you know, to organize, to hold a town hall at your church or at your community center, in your house, right? You got to get back to the basic precinct level organizing. We can have Yardy Gras, right? Put the grill out front and let's pull up in the front yard, y'all, and let's get this thing. Contact your representatives and your elected officials and tell them to expand and defend Medicaid, right? From the city council person to the congressperson to your governor to whomever it is. Call them all. Put them all on blast, y'all. If you're doing a little bit, okay, thank you, but you can do more, right? Here are some other things that we need to do. So I just want to thank y'all. Thank y'all for joining us for another episode of Unnamed and Unbound. And as always, y'all, Black Voters Matter 365, and we fight back.